Hopkins County, Kentucky remains the hot spot in our viewing area when it comes to the number of coronavirus cases. There are 94 cases with 8 deaths. 40 people, though, are recovering. Today, I talked with Dr. Wayne Lipson with Baptist Health in Madisonville about the spread of the virus in Hopkins County. Dr. Lipson, I want to start off by asking you, Hopkins County, one of the hardest hit areas in our viewing area. Why do you think the virus has been able to spread so easily and so quickly there?
Well, unfortunately, when we were starting to prepare, the governor was also preparing and had suggested that we try to socially distance as much as possible. Our local mayor and county judge executive were also doing the same thing on a daily basis. Despite that, there was a community gathering that happened almost a month ago now, and as a result, there was some people had COVID there, and then it spread from there, which caused a large community outbreak. So that's been going on now for about 3 weeks. And we are continuing to see cases, but the positive news is I think we're sort of on the downward slope of that flattened curve that we've been talking about.
You're still seeing some flare-ups there in the county. Is that true?
Yes, that is correct. From the original community outbreak, we now see some patients that are at some of the nursing home facilities that are getting the virus, and that they're which is requiring hospitalization of those patients.
Yeah, there's a few nursing homes in Hopkins County that the health department said is affected by this. Is Baptist Health working with health providers at those nursing homes?
Yes, we are. We are working to help them, to potentially help them staff, because they've had illnesses in their staff, as well as, to teach them infection control, with the use of PPE and how to preserve, the personal protective equipment to protect the patients and the staff itself. And we're also working with the medical directors there to help them any way we can. So to have an open line of communication. So if they do have patients that are positive and they are having symptoms of the virus, then we will take them over to the hospital and treat them accordingly.
I want to ask you, you mentioned social distancing, because that is what the experts say will really help stop the spread of this virus. Do you think people are really taking this seriously?
Well, I think that, fortunately, as I said earlier, the governor and our judge, exec, and mayor have really been emphasizing this on a daily basis. I do think the curve has been significantly flattened, if you will. However, we do see out in the public people that don't take it as seriously as we wish they would. We've heard of stories of people that are quarantined with the virus having COVID parties and having quarantine parties. And I mean, that is unfortunate. We know that young people, generally, if they know they have the virus, it's just a mild case of something like flu-like symptoms. However, if you're in your 50s, 60s, and 70s, and you have what we call comorbid conditions such as heart disease, lung disease, kidney disease, you may not fare as well, and you may end up having to come into the hospital if you show symptoms of shortness of breath, for example, or diarrhea, which we're seeing, those things require hospitalization. But really, the people that get in a lot of trouble are the elderly folks, those that are 80 and over. And it's not the young people that are having that issue, but if the young people are out and about having these parties and they go visit mom or dad or grandma and grandpa, that's what can cause a lot of the spread to occur.
And there is some good news out of Hopkins County today. We learned that a 103-year-old woman had COVID-19 and is now clear of the virus. Is that true?
Yes, we heard that today. That is great news. We know that we've had in the county 94 confirmed cases. 40 of those we know have recovered, and we know there's a lot more that have had it and that have recovered, but they may not have been tested and they just, recovered on their own. So that's great news. And we've been having several recoveries at Baptist as well. And getting people off the breathing machine, we've been able to do that over the weekend. So this was a good weekend for us in terms of patients recovering from COVID.
Yeah, is this a positive sign now that we're starting to see more and more people recover?
I think so. And, we just hope that even though that's positive news, it doesn't mean we should let up right now on the social distancing. If we can just, continue to do this, I know it can be tough to be, at home. But if we can continue this for a little bit longer, I think that we'll be able to get through this and limit the amount of people that end up coming to the hospital and people dying from the virus.
Absolutely. Dr. Lipson of Baptist Health, thank you so much for talking with us.